Self-blame is another thing that we look at with all of our kids. We do ask them, when you think about what happened, do you feel like any of that was your fault? That sounds like a threatening question, but many children welcome that opportunity to talk about their feelings. And it's also an opportunity as a clinician to clarify why they shouldn't feel that way. We can't make them not feel that way, but we try to give them a different way to look at it. So 50% of kids say yes to that question. Some of them blame themselves a little, some blame most, some say it's entirely my fault. Okay? Why do they blame themselves? Well, I should have been able to prevent or stop the abuse. So when he called me to his room, I never should have gone. Should not have worn certain clothes. If I hadn't worn those shorts that day, he wouldn't have noticed me. Should have yelled or screamed or fought. Or I should have told after the first time. That's actually more common. It's kind of like the fool me once, shame on you, fool me twice, shame on me. I should have told after the first time, because after that, then it's my fault, because I didn't tell. That's very common, the way to think about that. So they allowed it to continue. And by not telling, they may have resulted in other kids getting hurt. You heard some of those themes on the Sandusky trial, right? Some of the victims that came out said, oh my gosh, if I had known that other kids were going through this too, and I could have stopped it. I mean, they're really dealing with a lot of trauma on that. Physical pleasure, betrayal of the body is sometimes an issue for the victim too. Blame, self-blame, and shame are very closely related. With shame, there are just some kids who have great difficulty saying what happened to them because it feels so bad just to say it. And for those kids, we sometimes will offer them the option of writing it down. It's a little better for them then. But it's a degrading experience. There's questions of self-worth, and that's closely tied to feelings of self-blame, questions of gender identity for some of these kids, confusion about intimacy, betrayal of their own body if there's a physical response, and just the feelings of damaged goods for some of these children. I'm never the same again. And that's one of the nice things about the medical is so many exams are normal. We can provide some reassurance to them. You know, from my perspective, the medical is just a small piece. It's dealing more with what's going on inside and what's going on in their head. It's far more important and needs far more attention in terms of healing. Some kids don't tell because they didn't know it was wrong. And this is not just referring to young children. It's referring to older ones too. And here's, again, another quote. I didn't tell because he told me not to. And my mother told me to trust him. So this was a family acquaintance, a male, who was babysitting for this girl while her mother went, and I think she was either working or she had to go somewhere. I didn't know it was the wrong thing. In health class, they told us it was the wrong thing and that it was important to tell. So she was 12. 5 years later is when she told about her abuse. So how do they cope? And many of you are better versed in this than I am, but some of the observations I have just as a clinician is they push it down, they repress it, they accommodate it, they somehow integrate it with the rest of their normalcy. They reinterpret, this is really all my fault, or since adults are always good and kids are always bad, what's happening here is because I'm bad. So they just reinterpret it. But sometimes they have anger, like I talked before. I think anger can sometimes be pretty good, but that sometimes they're acting out. And that's how they get discovered is they found acting out with another child. And what does the mom ask? Where did this idea come from? And that's when the sexual abuse might be disclosed. This is, I think, one of the best descriptions of what dissociation feels like. I felt like screaming. It hurt. But it was like I was in a dream. You try to move, but you can't. You open your mouth, but there is no sound. You can't scream when you're dreaming. It seemed unreal. We go through that. You know, when you're in a car accident or something very traumatic and sudden unanticipated happens, you have a disconnect. You probably don't even remember what you were doing in some instances. You have a disconnect. It's the same thing for some of these victims. I have no anger, fear, or sadness. I feel nothing at all. If I feel, I hurt, so I've made my feelings go away. Memory without feelings, and sometimes feelings without memory, and go the other way around. So when coping fails, what do we see? And again, this is the basic pediatric kind of approach. It's a lot more detailed when we get into the mental health approach. But in general, what I see most often, if there are symptoms, is nightmares. So again, these children are often very good at pushing it down during the day and going on as usual, but at night when they let their guard down, it comes out in nightmares. Nightmares about the abuser, their family being hurt, they're being chased, they're going into a black hole. Those are the common themes that we hear. Sometimes trouble sleeping, of course, goes along with the nightmares. School dysfunction is another very common. I can't focus, I daydream a lot. My mind wanders off as I'm trying to work and concentrate. Anxiety is also common. We measure some of these things with the trauma symptom checklist for children that you may know about. It's like 43 items. They fill it out themselves. And we get some interesting responses. But one of the symptom groups in that checklist is anxiety as well as depression and self-injury. Intrusive thoughts. We ask kids, even as young as 8, have you ever felt so bad that you wanted to hurt yourself? Or you felt like dying? Have you ever felt that way? And we get about a third would say yes to the question. About half of them would have already had some self-harming behaviors, like cutting, of course, being the most popular. And they take erasers now. Have you seen that? And they use erasers. They get scars from that. I don't know what it's called, but they will also use those approaches too. But sometimes kids as young as 8 or 9 have thought about hurting themselves. And I remember an 8-year-old girl said yes, and I went to the kitchen, I took out a knife, and I held it right here. And I really thought about it, and I couldn't do it. So I think the message is here is to think of younger kids too, not just adolescents, but it's a question of self-injury. I thought this was another interesting response from a victim. This is talking about what her feelings are like. And I thought it really captured the whole idea of confusion and why is this happening to me? And the feelings just wrapping around and making her feel very lost. So it says, when I got lost and when I'm scared, I feel just going out of control. And when I sleep, sometimes I feel like I'm going in circles at night. Sometimes I feel like sleepwalking, but when I open my eyes, I'm not. Sometimes I want to go in mom's room because I'm scared. Sometimes I got this feeling inside my pee-pee, I don't know what it is. I think that's all, but if whoever come back, probably write it down or can it. I don't think that's right. And then the boy I like, his name is Kenny. He's in the 5th grade. I'm not sure, but he's 11 or 9 or 11, 10 or 9 or 11. You know, it's kind of confusion. It's overwhelming confusion. So here's your first test question, and you probably know the answer, but when is coping most likely to fail in these kids? When are we more likely to see reactive behaviors in sexual abuse? When the child hates the abuser, loves the abuser, blames the abuser, or blames himself. So who votes for A? B, C, and D. Okay, D is the answer. That's what self-blame is very highly correlated with all the trauma symptoms. There are 13 trauma symptoms that we looked at, and the more blame they have, the greater the number of trauma symptoms, which is why that question is so important to ask. How and why they tell. So how long do they wait to tell? Well, the average is about 2.3 years. The median, if you can remember your math, is 5 to 6 months. So the median is the time by which half of the folks tell, 50% tell. So because you have a median of 5 to 6 months, you have an average of 2.3 years, that means the range is huge. It's from a median on up to 15 years or more, at least in the study that we gathered these numbers for. We're looking at these numbers again in our new study on disclosure, and it's a little bit shorter, but we don't have all the data yet. So again, let's think about what's been going on in the child's life by the time we find out about the abuse. Who do they tell? Well, and again, we're looking at this again, but at least in our 1990 study, they tell another kid. And that should make sense because they're still not sure about all the consequences of telling an adult. They're not sure about the reporting, all that other stuff, but it's building up inside of them. They have to tell someone. So in our study, they told 3 or 4 other kids before they told an adult. The good news about today that's different than 20 years ago is that many of these friends they tell convince them to tell an adult. That's great. I mean, there really are some really good friends out there, and they're telling victims to tell. They're helping them tell, or if the victims won't tell, they're telling their mom or they're telling the school teacher about it. So this is a better trend that we're seeing now. Adult relative, about 32%. Non-related adult, around 10%. School personnel were low in this study. I have hopes that it's higher now, because again, I think kids are more comfortable talking about this at school. The adult relative, curiously enough, it's not always the mom. Because remember, kids are very close to mom. And again, going back to our hypothetical 8 or 9-year-old, mom is the most important person in that child's life. And risking that she may cry or be upset about this is more than a child can bear sometimes. And this is a very important role for me, because mothers, when they come to our clinic, are often devastated. Why didn't she tell me? We've talked about this. Why didn't? And my answer is because she loved you. That's why. Because she loved you. She didn't want to be responsible for your distress. It's easier for them to talk to me because I don't have to worry about my feelings. It's harder to talk to somebody you know and love because kids are worried about that. They want to fix it. So in our study, we asked, did you tell about your abuse? Because remember, we were asking young adults in our study as well as sexually abused children. And when we asked the young adults, the 18 to 22-year-old group, there were about 300 of them, of those that were sexually abused, did you tell anyone? The good news was 75% did tell someone. Bad news was that only half the time when they told did the abuse stop. So in other words, it's not uncommon for kids to tell someone and it never gets reported. And what's more is that person that tells, there's no action that results in stopping the abuse. So in other words, if it's somebody in the home, that person is still in the home after they tell. It should make sense that when children see the abuse as the other person's fault, they're more likely to tell. They blame the other person, they're more likely. But again, that self-blame is a great silencer. So if they feel like any of it was their fault, they're less likely. So why do they tell? I want to talk about it in terms of big themes, big categories. The most common reason that kids tell, and I think it's going to hold true today too, is what I call internal threshold. I couldn't sleep, I couldn't think, I had to tell so my life could go on. Those are the sorts of themes we hear. So it's like there's a cup inside, and one day, perhaps because of some trigger, it overflows and they have to tell someone. Like a balloon getting bigger and bigger inside of me, one little girl said. I had to tell, it was going to burst. So that's the feeling. The second most common themes for why they tell is protective reactive. I was afraid someone else would get hurt. I wanted him to be punished. Again, getting a sense that maybe he's abusing the sister or a sibling or a cousin, something of that nature may cause them to tell. And then the final, or the less common group, was the external influences. And this is what I'm curious to see if that's increased because of our increased number of programs with sexual abuse. So those are the themes. What is the thing that tips them over? And sometimes there is a specific event that tips the child over into the decision that I'm going to tell now. And I see that as two different kinds of triggers. One is that the perceived threat, and that's what's important, is what the child thinks or what they perceive. It either increases or it decreases. And examples of things that would increase that perceived threat would be the type of abusive acts become more intrusive. Also, all of a sudden, it's more often, Now there's more clothing being removed. They see it moving towards something that's more frightening. So their fear finally takes over. Signs that the sibling may be abused is also a very important trigger. Situational changes that increase the abuser's access to the child. For example, unemployment. Let's say all of a sudden the abuser is unemployed, it's going to be home a lot more, picking the child up from school. That could also be a trigger. Or alternatively, perhaps a perceived threat decreases. And examples of this would be somebody that leaves the home or leaves the vicinity, goes on a trip or separates from their adult partner. The child receives information from a program or trusted individual that lessens the stress. Wow, somebody might actually believe me. I don't have to worry about that. I have this person at school telling me that they're going to believe me and support me and report it. That's good enough for me. Or the child perceives the mother as trusting and believing. I find it interesting that sometimes when I see adolescent girls, the outcry, the disclosure from a child comes in the midst of an argument they have with mom. Okay? Maybe mom is having marital problems, and maybe the person that she's with is the person abusing the child, and they come to some agreement that there's something about this individual that they both dislike. And at that point, sometimes adolescents would say, now's the time to tell her, because she doesn't think he's perfect anymore. So we've talked about these themes before, why they didn't want to tell. Fear, shame, embarrassment, and also about a third of our kids feeling ambivalent. They're loving that person, but not liking the abuse. So this is an interesting study. It's a very old study. The question was, do children tell on adults? And it was done in a first grade classroom. So they had about 20 of these kids sitting in the classroom, and this is the experiment. The teacher was up at the front of the room. She had a glass of water on the table. And she said to the class, I want everybody to be quiet. I will be back in a few minutes. Just sit and read your books, okay? So she leaves the room, and in a few minutes, this person comes in, and he's very friendly with the class. Hi, how you doing? I'm Frank. How are you doing today? And he starts doing funny things and dances, and when he's dancing up at the front of the room, he knocks over the glass of water. He turns to the class and he says, shh, don't tell anybody I did that, okay? Bye-bye. And then he leaves. So they interviewed the 20 kids individually later. So this is another test question, okay? So how many of the kids, when they were asked who broke the glass, how many of the kids told the truth is the question. I'm going to give you three choices. You can say 2/3 or more, about half, or fewer than 1/3. Okay, so who thinks that 2/3 or more told on the guy knocking over? 50%? Less than 1/3. That's the answer. Now, it blows me away because all he said was don't tell. Complete stranger, they had no idea who he was. So when you're in a sexual abuse situation with somebody you're supposed to love and know and trust, and they say don't tell, don't you think that might be more powerful than that classroom scenario? So it also shouldn't be surprising that when a report is made, that sometimes kids shut down and they don't tell, particularly if the way the system acts. So sometimes the CPS worker may come to the school and interview the kids. Sometimes the police will come to the home and interview the family members. The point is that if the child feels threatened or thinks that the abuser might be nearby, they're not going to say anything. So we have to keep these things in mind. Also, when somebody comes to school and pulls you out of a classroom to go talk to someone, that's also a very unfamiliar, sometimes somewhat threatening scenario for kids too. I don't think they do that so much anymore, but again, understanding what the child's perception of what's going on may affect their willingness to tell is important to keep in mind.